Okay. This is Tracy. Gosh, I'm getting old. Yikes. Anyway. Ooh, that's gross. Anyway, I am just posting these videos because of health issues that I've been dealing with since 2022. If I go on and tell the whole story, I could be writing a book, but so I'm just going to post a little every day. I was going to start yesterday, June 1st, and do every day to kind of give an update on just everything and, what I've been going through and just how that day is, kind of stuff. Anyway, but I couldn't because I was extremely ill and couldn't move, walk, couldn't even get out of bed to barely go to the bathroom. Anyway, so in 2022, I had a full laparoscopic hysterectomy. And the only reason why I really did that is because I was bleeding so much and because of the menopause and stuff like that. And we tried everything before the surgery, like the pills and, all this other stuff. So I was like, let's just do the surgery. 4 years ago, I was 48, and so there was no way I was going to have more kids. And my one kid, Jackson, is 24. So anyway, and uterine and ovarian cancer runs in my family anyway. So I thought, okay, just take it all out. And I knew I would get menopause like right away, but I was already going through it, not sleeping and just sweating. I was changing sheets twice a night and my clothes 4 times a night. It was just horrible. I mean, life sucked. But so then I thought getting this hysterectomy, yeah, the menopause would be full force, but I thought it was full force before. But I thought, okay, anything to stop the bleeding. I was changing a pad every 45 minutes and I was becoming like having no blood in my system. So super weak, all that stuff. So 2022 September, I go in for a hysterectomy, which they say is like a common normal surgery that they do all the time, which I'm sure they do. Anyway, mine wasn't so normal. And I know there's always complications and things that can go wrong, but nothing that has happened to me. So I'm just going to name a couple, and then, in other videos, I'll go more in depth on what they are, the treatments, the permanent damage, and, what I deal with on a daily. So, first off, I was in excruciating pain. I mean, the pain was fierce. So nothing was helping it. Morphine, they gave me morphine. Morphine wasn't helping the pain. And then fentanyl. And that was the only thing that kind of calmed it down a little bit. And usually they don't give you fentanyl. I mean, it was that bad. So in my mind, I thought that was just normal, I guess, after a surgery. So the doctor sent me home with some Vicodin and, call in 3 or 4 days and whatever it might be. And then in a week, you'll come in for a follow-up. Anyway, I got home and I could barely stand. I could barely walk. I wasn't peeing. I wasn't going to the bathroom. And I was calling the on-call doctor like every 2 hours. No, you're fine. You don't need to go into the ER. This is just normal. This is normal. Well, it's not normal. So if you're having any kind of pain like that, or even not peeing, there's something really wrong with you. But I didn't know that. I was just being told that this stuff is normal. You'll be fine. Don't worry about it. So thinking that I'm going to listen to the doctor, I did. But I was still in excruciating pain. So after 4 days of being like this, and remind you, my pain medication was refilled once a day. And so I was going through, I think, 20 Vicodins a day because of the pain, and it still wasn't helping. And then the laparoscopic area that she did, come to find out, was never securely closed. And that was another main reason of the pain, because it felt like it was on fire. But anyway, so I'm kind of getting off. But the number one most horrible thing that had happened is she damaged my vagus nerve. And if you want to Google that, it's the main nerve from the top of your head in your brain. It's the number one nerve in your body that goes all the way down to your feet. So it's a huge, huge nerve to be effed up. So what it's done is, like right now I'm laying down, but in about an hour, I'll have to get up and walk around because my right side, my right arm, and my right leg will get numb. And it's because of the nerve in my stomach that's damaged. Number two, well, so I don't sleep through the night. I haven't in 4 years, and I probably never will, because it's permanent damage and they cannot fix the nerve. Once a nerve is dead like that and they tried to fix it, it doesn't work. Number two, it messes with your digestive system like no tomorrow. It's horrible. And then also it goes in with your digestive system, but when you go to the bathroom, number 2 and number 1, that nerve is part of the vagus nerve. And so when that's damaged, when you have to go either pee or poop, there's like a signal that's supposed to go to your brain that says, oh, okay, so let's go to the bathroom. Well, when that's damaged, there's no signal. And also, she damaged the nerve that helps me go to the bathroom, number 2. So, long story short, I have 0% contraction rate. So, having to go, number 2, I don't feel like I have to go. And then also pushing. So when you push to go to the bathroom, it affects your vagus nerve in your stomach. So if you push too hard, or if I push too hard, I pass out, because then the blood flow to your brain and oxygen and all that kind of stuff slows down and you pass out. It's horrible. But another thing that had happened was, so I knew something was going on. I had every single test, and all the tests were like, okay, well, it's because you had surgery and this is normal. All your tests will come back to normal. And so I was just very upset. I knew something was wrong. So I had a PET scan. And usually they do that for cancer, but I insisted. It's a very expensive. Insurance doesn't want to cover it, but I fought for 2 months to get this thing. So it finally went through. And they said, my internal medicine doctor at the time, I can't tell you how many doctors I've seen. My bills are over $1 million and counting. She says, well, on the scan it says that something might be wrong with your gallbladder, but I think it's just a false positive. And maybe it was emptying slower during the scan. And I thought to myself, no, something's wrong. And she's just like, well, no, we're going to send you to an infectious disease doctor. Because I believe she was sending me to infectious disease is because my skin was on fire. It looked like I had acne, and it wasn't acne, it was sores all over. I mean, you could probably see they're like everywhere on my skin, and they're everywhere. I'll show you pictures. So she thought maybe I had an infectious disease or something might be going on. Anyway, it wasn't that. It was the horrible bacterial infection from her not closing up the incision on my stomach, and also because my gallbladder wasn't working. So I went into a general surgeon, and you usually only can go there if you get like a referral or whatever. And I said, screw this. My husband's like, screw it. We're just going to go pay. Just go see. So I went in there. I was telling her about what was going on. And 2 minutes later, she goes, pull up your shirt. I looked like I was 9 months pregnant. And she goes, that's your gallbladder. She touched my stomach, and I thought it was like a knife going into my stomach. And everybody kept, for months and months and months, almost over a year, they kept on, oh, you're fine, or this is normal, or it's psychological. And that really pissed me off. Okay, both of them. Not normal, not psychological. So I went in and did a HITA scan, came back out. Yeah, it's only working at 4%. Hello, did I not tell this internal medicine doctor, I think we need to do another test on my gallbladder? No, it's fine. Don't worry about it. It's false positive. Next day, gallbladder removed. So, it's all going on 12 minutes, but I'm sorry for going on, and I'll get more in depth. But please, listen to your body. I don't care. Listen to your body. And find somebody who will actually listen to what you're saying, because you're the only one who knows what's going on. You're the only one who can feel what's going on in your body. So the only confirmation that I got and was told, yes, this is what's going on with your body, and yes, I hear you, and the tests confirm it, was at the Mayo Clinic in Rochester. And you can go there, but for like in-depth testing like what I was doing, it's a referral. Otherwise, you're on a waiting list. Or you go into the ER there, which I live 2 hours away. Yeah. But the reason why I'm laying in bed today is because I haven't pooped in 3 weeks. So, and that's normal. Usually it was 5 to 6. So, yeah, it's bad. So the only way that I can go to the bathroom is by taking not 1, not 2, but 3 laxatives at a time, and it kills my stomach. The lining of my stomach from the bacterial infection that I had for over a year, it ruined the lining of my stomach, and it ruined the opening from my esophagus to my stomach. It is so thin, and it corroded, and so it kind of like closed up. And so I've had balloons in that area to open it back up so I can eat normal. But I'll never be able to eat normal again, because I can't have like meat. I can't have lettuce. I can't have like corn. I can't have anything that is not like water-based or doesn't digest like immediately. So pretty much a liquid diet. But I will get into more of that. So just listen to your body, and please, like subscribe, follow, whatever you do. I'm 51. I'm not good at all this social stuff, but I thought this was the way to get it out and try and get some help for myself, to try and let this doctor not get away with this again by doing this horrible surgery. So please just follow, and I promise you, no matter how I'm feeling, I will post every single day on everything that I've been through and what you can look out for. So I really appreciate your time. This is Tracy, and take care, listen to your body, and have a good day. Bye.